Okay, so I just want to talk about a few of the kind of logical fallacies that have been going on with the Scottish Government throughout this crisis. The first thing and the most important thing to note is that I 100% stand behind the prioritisation of children and their education. My business partner has 2 young girls, and I've seen firsthand through this how impactful this has been on them. They need to get back to school, they need to see their friends, they need to be able to sit exams properly, and I'm fully behind that decision, but there's a few things that have gone on where the Scottish Government have contradicted themselves, and I think it's important to address these. So, firstly, they've talked about the order of undoing the lockdown, how they want to go from potentially least impactful to most impactful, yet pubs, bars have been opened before gyms. Now, we know that approximately 15% of the population of the United Kingdom hold a gym membership. If we assume that that holds true in Scotland, that would put 825,000 people that have a gym membership in Scotland. Some of those people won't use the gym, some of those people won't be comfortable going back to the gym, but let's use 825,000 people is the maximum number of people that could be impacted and potentially contract COVID-19 in a gym. Now, approximately 53% of the adult population of the UK go to pubs or bars or clubs in their spare time. So 53% of Scotland's total population is approximately 2.7 million people. So I want you to tell me which has a greater magnitude, 825,000 people or 2.75 million. So that's problem number 1. Number 2, that population that goes to the gym generally has a better health status than the populations that go to the pubs and bars. Now obviously there's some crossover. However, a study from Public Health England stated that obesity and being overweight increases your risk of, number 1, contracting coronavirus, and number 2, the severity of those symptoms increasing. And I quote, "And the risk grew substantially as body weight and BMI increased." So again, you're looking at a significantly lower number of people who generally have a higher health status, and yet gyms are right to the back of the queue. And the reasons for that is around the Scottish Government's supposed theories that 2 main problems. Number 1, changing rooms are poorly ventilated. Now, I resent that. As a gym owner, that's a really blanket sweeping statement that I think shows an outdated view of the private gym sector and the main gym sector. Gym changing rooms have to be well ventilated so you can get the air out of the showers, otherwise you just have mold everywhere. And if that is that much of a problem, fine, just don't have the changing rooms open. Have them open for toilets only. And that's what we at Lift plan to do once we're actually finally allowed to reopen. And number 2, the Minister for Public Health has written a letter where he explicitly states that perspiration is a worry, transmission of COVID-19 through perspiration. Now, the World Health Organization and the Government of the United Kingdom specifically state all secretions from COVID-19 patients except sweat should be regarded as potentially infectious. So if the Scottish Government has information that shows that COVID-19 can be transmitted in sweat, you would think that they should share that. They have a moral obligation to share that information with the World Health Organization and the UK government. They have been evasive throughout this entire process. We have written to Nicola Sturgeon, and I know several other gym owners have written to Nicola Sturgeon and various different ministers. We are not getting any response. It's a blanket response which is clearly cut and paste every single time, to the point where I have had to submit a Freedom of Information Request Act to get the clinical guidance that Nicola Sturgeon has been referring to when she is saying that gyms should not be open and they are high-risk environments. I still haven't had that. There's 20 working days as the timeline to get that. And so far we're on working day 12. I still haven't had that information. I, as a gym owner, need that information to make my gym as safe as it can possibly be. And as a government, they should be doing everything they can to help us prepare and be ready for when the sector reopens. Now, if the sector does reopen, there is obviously a chance that there could be an outbreak and a surge, and it could be related to gyms. However, there's a large study that's come out from Norway where over 1,500 people went to the gym and they were tested, and there was only 1 meter social distancing in place in the gym, 2 meters for high intensity exercise. And guess how many cases of coronavirus were contracted in a gym? 1. Oh no, but wait, when you actually look into the study, that 1 person in the gym group who contracted coronavirus actually contracted it from their workplace and hadn't visited the gym. And the study concludes by saying, provided good hygiene and social distancing measures are in place, there was no increased risk of COVID-19 spread at training facilities. Now again, I would like to see the evidence that the Scottish Government has that directly contradicts that status. The Scottish Government also talk about their overarching public health reform that they're trying to go on. There's three main sectors here where they are in breach of this. Number one, a Scotland where we have good mental well-being. Now, those of you who go to the gym know how much it can do for your mental health. There are countless studies that show that exercise is a more powerful antidepressant than the most powerful tablets and pills that we have out there. Yet Scottish people can't exercise in a gym. Now, that's okay at the moment because we've actually had quite a good summer. But you tell me, if you want to go for a run outside when it's the 21st of November, it's howling with wind and rain, but you can come to the gym where it's warm, well ventilated. The Scottish Government isn't letting that happen. Number two, a Scotland where we eat well, have a healthy weight, and are physically active. Eat out to help out has been applied to fast food restaurants. There has been no incentives given so far to actually help people exercise, be physically active, and have a healthy weight. There's no official Scottish Government guidance. This is despite Scotland being the sick man of Europe, with the highest obesity rates, the highest child obesity rates in the whole of Europe. This has to change. Gyms have to be at the forefront. And finally, public health reform item number three, a Scotland where we have a sustainable, inclusive economy with equality of outcomes for all. You tell me how directly ignoring the leisure sector is an equitable outcome. Fund the sector. Nicola Sturgeon, I'm talking to you. Fund the sector. You've poured out £2.3 billion elsewhere. You have ignored our sector. How is this an equitable economic outcome? That's all I've got to say.